Hey guys, welcome back to my channel. Today's video is going to be on basic math calculations. In this video, we are going to discuss 4 of the most common types of calculations. We will discuss oral dosing with tablets and capsules. We will discuss IV dosing or IM dosing or oral, so liquid dosing, whether it would be an IV push, an IM injection, or an oral liquid. We are also going to talk about milliliters per hour with an infusion pump and drops per minute using dial regulated tubing. So hopefully you will find this video helpful. It is at a fundamentals level. And of course, if you have any questions once the video is over, please don't hesitate to reach out. Okay, guys, so welcome to Basic Math Review. This is going to be fundamentals dosage calculations. And we will just hop right in and go ahead and get started. So of course, with any type of dosage calculation problem, there is always the possibility that you might have to do a metric conversion. Now, you won't always have to do a metric conversion, but you occasionally and a lot of times will have to do a metric conversion. So remember, in order to know if you need to do a metric conversion, you want to look at your order, and then you want to look at what's available or what's on hand or what you're sent from the pharmacy, and those metric measures need to match. So for example, if your order is in milligrams and what you have available is in milligrams, you don't need a conversion. But if your order is in micrograms and what you have available is in milligrams, then you will obviously need to do a conversion. Now, there are lots of ways to do metric conversions. I'm going to show you a few on the screen. The only one that I truly discourage, again, it's totally up to you though, is moving the decimal place. And the only reason is because what I find is sometimes students move the decimal place too far, or they move it not far enough, and then that messes up your entire problem. So to me, it's easier to think, instead of moving the decimal place, you're either multiplying by 1,000 or you're dividing by 1,000. And if you perform that calculation on your calculator, you're never going to mess up your decimal place because it's going to tell you what it's supposed to be on the calculator. So this is a mnemonic that some students like. If you don't like it, you can ignore it, but if this is something that might help you. So basically what you're trying to understand is which direction to move your decimal, or whether you're multiplying by 1,000 or dividing by 1,000. So in this acronym, the acronym is King Henry died by drinking chocolate milk. The B in by is your base measurement. So you have your base typically is either units, grams, liters, or meters. Now, in this class, we don't do much with units. You will eventually work with units or milliunits. One great example is oxytocin in OB. And we don't necessarily work that much with meters. However, centimeters you will work with, again, in pediatrics when you're doing pediatric measurements. So for our purposes today, we're really going to focus on the base unit of grams and the base unit of liters. So again, when we think about the base unit of grams, if we want to go to kilograms, we have to go to the left, which means we have to divide by 1,000. Now, if we want to go to milligrams, we're going to go to the right and we have to multiply by 1,000. Now, if we want to go from milligrams to micrograms, we have to multiply again by 1,000. So this is just a nice way to think about which direction you need to go, depending on what unit of measure that you're looking for. So if you like this acronym and you find it interesting and you want to learn more about it, I will share, of course, this PowerPoint with you guys, and there is the YouTube video linked below. So however best works for you, you have to figure out a way to successfully do conversions. Now, these on the next screen, these are the most common conversions that we deal with in healthcare. So definitely micrograms to milligrams, very, very common, or milligrams to micrograms, so the reverse. Grams to kilograms, we don't see it so much in adult health, but we definitely see it in pediatrics, neonates, very common that we have to go from grams to kilograms. Milligrams to grams, grams to milligrams, very, very common. And then of course, converting your weight. So pounds to kilograms, kilograms to pounds. Now in healthcare, all of our weight-based dosing is going to be done by kilogram. So in fact, we don't typically even weigh patients in pounds and document it that way in healthcare facilities because it's useless to us. We need to know what that patient's weight is in kilograms. Now we also have milliliters to ounces and vice versa. So this is going to be really important when you're doing intake and output. I'm not going to talk at all today about milliliters to ounces. That's a pretty simple conversion, but maybe I&O is a discussion that we can have on another day, but definitely you have to be able to calculate your intake, calculate your output. So maybe your patient had 6 ounces of coffee, but what you have to document in your medical record is in milliliters. Inches to centimeters we talked about, not super common in adult health, but more common in pediatrics. Units to milliunits, again, very common in OB, not so much for many other medications. Milliliters to cubic centimeters is not something that you will see in a testing environment, but I do like to explain it because you will work with older providers who still write CC. Well, CC is the same as milliliter. Now, CC, the abbreviation in and of itself, is actually a do not use abbreviation because it's easily confused. Nurses don't know what it means, and they can confuse it for centimeters or something else. So, but if you were to see CC on a provider's order, that is the equivalent of 1 milliliter. So 1 milliliter, 1 cubic centimeter. However, you won't see that on standardized testing. Teaspoons to milliliters, very, very important. Milliliters to liters, another really important one. Being able to go from teaspoons to tablespoons and from tablespoons to milliliters or milliliters to tablespoons. And then every once in a while, we do have to convert a medication that's in grains. Typically, that's aspirin that is dosed in grains. I don't see it as much as I used to see it way back when, but if you were to see GR or spelled out grain, that is 65 milligrams. Okay, let's talk about some general rules for dosage calculation. The first is that you have got to check for your conversion. Do you need to do a conversion? That's always the first thing I like to decide. Now, if you're going to do formula math, you're going to do your conversion first. That's going to be the very first step. If you're going to do dimensional analysis, you're just going to work your conversion into your dimensional analysis chain. But it's really important that you first decide, do I need a conversion? And then you don't forget to do that conversion. So when we think about, for example, what you see on the screen, acyclovir 500 micrograms, what you have, that's the order. What you have available is acyclovir 10 milligrams. That's your clue that you need a conversion. Now, the other thing to keep in mind is that time is also a conversion that sometimes we need. So for example, if your order is per minute, so as in the example that you see on the screen, micrograms per kilogram per minute, now that is critical care dosing, so we won't see that in fundamentals. But if your order is in minutes, but what you want to administer is milliliters per hour, you have to do that minute to hour conversion. Now, another example that we are going to talk about today is drops per minute. So your provider will order so many milliliters over so many hours, but the end result that you want is drops per minute. So minutes and then your order being hours, that doesn't match up. So you have to do that conversion, and we will practice with that today. Whenever you see volume or liters, milliliters, teaspoons, tablespoons, that's liquid. So always remember your answer can't be capsules or tablets because it's volume. It's going to be milliliters, liters, teaspoons, or tablespoons if it's a liquid. Now, flow rate is either milliliters per hour or drops per minute. Now, this is really important to remember. These are always going to be whole numbers. Milliliters per hour, drops per minute. Now, a standardized exam won't always tell you to round to the nearest whole number on milliliters per hour or drops per minute. because you're expected to know that. In a standard IV pump, and definitely for drops per minute, you cannot insert into those machines or dial on your drops per minute tubing a portion of a drop or a portion of a milliliter. Now, of course, we're not talking about critical care math because this is fundamentals. Now, there are machines in critical care that you can give a portion of a drop of fluid, but for our fundamentals purpose today, milliliters per hour, drops per minute, always a whole number. Even if you're not told to round to a whole number, always round to a whole number. When we're talking about infusion pumps, that's always going to be milliliters per hour. If you see the word drop rate or gravity rate, that's your drops per minute. Again, always has to be a whole number. Okay, other things that I want to remind you of are that you need to watch for wording. So the way your order is worded is very, very important. So let's look through at some examples. So amoxicillin 800 milligrams POTID. What that means is that you are going to give 800 milligrams 3 times a day. So remember, TID 3 times a day. The order is for 800 milligrams. So every time you give the medication, you're giving 800 milligrams. However, let's look at this next order. Amoxicillin 800 milligrams daily in 3 divided doses. Now that means that you're going to give 800 milligrams in 24 hours, but you're going to have to give the doses divided. So that basically means that you're going to take your calculator, and 800 divided by 3 is about 267 milligrams. So when it shows you that, when it shows you that 800 milligrams daily in 3 divided doses, that means that you're giving 800 milligrams in 24 hours, but that you're not going to give 800 milligrams every time you give it. You're going to have to divide by the number of doses. So let's look at a couple of other examples. So amoxicillin 1000 milligrams PO 4 times daily. That means that you're giving 1000 milligrams every time you give it. 1000 milligrams PO 4 times daily. All 4 times you're given 1000 milligrams. However, amoxicillin 1000 milligrams PO daily, and it's that daily word that you're looking for, in 4 divided doses means that you're going to give 250 milligrams 4 times to equal your 1000 milligrams in a day. So that's really important to pay attention. And I find that when students struggle with dosage calculations, despite the fact that they know how to do the calculation, it's usually because of a wording in an order that has confused them. Okay, the other thing to pay attention to is, are you calculating a daily dose or a single dose? So your last sentence in your problem is going to say, how many capsules will the nurse administer per dose? Or it might say, how many capsules will the nurse administer per day? So don't miss that. If you're giving 1 dose, that's going to be a very different number in either capsules, tablets, or milliliters than if you're giving a daily dose. So pay attention to that. Remember, if you're being asked to administer tablets or capsules, your problem is going to look a lot different than if you're being asked to administer volume. So remember, pay close attention to what the question is asking you to administer. And then there are some pharm concepts that you need to remember. So you may or may not have learned some of these pharm concepts yet. So let's talk about them. You can't give half of a capsule. So you guys have all, I'm sure, seen a capsule. It's the, the little clear sheath, and it's got the beads on the inside. Well, you can't break that in half and get an equal number of beads in one half of the capsule and in the other half of the capsule. So if you're administering capsules, it can only be a whole number. So if you're not given rounding rules, but you know you're administering a capsule, you're going to have to round to that whole number. Same thing with extended release or enteric coated tablets. You cannot cut those in half. Enteric coated is designed to not dissolve in the stomach because it protects, so it has this coating on it that is protected from stomach acid so that it doesn't harm the stomach and cause GI upset. So it will travel into the GI tract or into the small intestine and then dissolve. Extended release is going to dissolve very, very slowly through the GI tract. So again, you cannot half any of these types of tablets. So if you know that you're giving extended release or enteric coated, whether you're given that rounding rule or not, you're expected to understand those pharm concepts. Okay, let's talk about what you need. That's important information in a question versus what I like to call junk in a question. So let's look at this question that you have on the screen. A provider orders rifampin 5 milligrams per kilogram IM every 12 hours for 4 days. The client weighs 84.1 kilograms, and the pharmacy supplies rifampin in a vial that contains 40 milliliters with a concentration of 25 milligrams per milliliter. And then your question, how many milliliters of rifampin should the nurse administer per dose? And then you are given some rounding rules. So let's talk through this question. So the question is asking you milliliters per dose. So automatically, you know, this is going to be volume. But you're told that it's going to be given every 12 hours for 4 days, but we're only giving a single dose. So it's irrelevant that it's going to be given every 12 hours. That's the frequency. That's irrelevant. It's also irrelevant how long the client is going to get it. That is information that we don't need. It's what I call junk. It's thrown into the program, to the problem, basically to throw you off. Standardized testing wants to know, do you understand what information you need in a problem versus what information you don't need? And in this problem, you don't need to know that it's going to be given every 12 hours for 4 days because you're giving one single dose. Now, we do need the weight. This is a weight-based order, so 5 milligrams per 1 kilogram. So the weight is important. Now, we're also told that rifampin is coming in a vial with 40 milliliters. Remember, we're only giving one dose. It doesn't matter to us how many milliliters are in that vial. What is important, and you have to pay attention to, is your concentration. So anytime you're giving liquid medication, whether you're going to inject it in an IV, in a muscle, or whether your client is going to swallow it, you have to be given a concentration of that medication. And it will look very similar to what you see, 25 milligrams per 1 milliliter. So it'll always be so many milligrams, micrograms, grams, milliequivalents, whatever your unit of measure is, per so many milliliters. It could be 1 milliliter, it could be 5 milliliters, it could be 10 milliliters, but that is your concentration. So many units of measure per so many milliliters. Now that's important. We have to have that. So remember, when you're reading the question, pay attention to what am I being asked to administer? In this case, it's milliliters per 1 dose. And then hopefully you can easily decide what you need versus what is that junk information in the question. Okay, we're going to start jumping into some problems here pretty quickly. So let's just break down a question so that we're all on the same page about what questions have in them. So the first is that you're going to have a prescription. Standardized testing nowadays is mirroring NCLEX, and so they're calling everything a prescription, but basically that's your order, right? So whether it says provider order or physician prescription, that's what you're looking for, that the provider has ordered. In this case, it happens to be digoxin 125 micrograms PO daily. Then you have to be told what you have available. So sometimes it'll say available, sometimes it'll say on hand. It might say you pull from the dispensing cabinet. It might say sent from the pharmacy, but that's the medication that you physically have in your hand to administer. And then you've got your question. In this case, it's how many tablets should the nurse administer per dose? And then more often than not, you do have those rounding rules. Now, the thing that I want to help you understand about conversions before we jump into actual calculations is I like to convert to what I have on hand. Now, you can convert to the order. It doesn't really matter. The answer is going to come out the same either way. However, what I have on hand is what I'm actually going to give the client. So if what I have on hand is digoxin milligram tablets, so 0.25 milligram tablets, I'm going to take my 125 microgram order and I'm going to convert from micrograms to milligrams. So hopefully that makes sense. If you want to go from milligrams to micrograms, your answer is going to come out the same. But to me, in the real world, it doesn't make any sense because you don't have microgram tablets to administer. You have milligram tablets to administer. Okay, so I do quickly want to talk about the different types of math that you can do. Now, if you do not do dimensional analysis, kind of tune me out for the next couple of minutes. And then in a minute, I'm going to talk about formulas. And if you don't do formulas, you can tune me out for formulas. However, dimensional analysis and formulas are the two most common types of calculation solving that students are taught and that they do. Now, certainly, I'm not saying that you should change anything that's working for you. I just want to make sure that if you haven't yet found what works for you for dosage calculation, I want to make sure that you are presented with both options. So if you want to do dimensional analysis, it is a 5-step process. So the first is that you have to determine what your final answer is going to look like. So for example, are you solving for capsules per dose or milliliters per dose or milliliters per hour? What do you want your final answer to be? I always start there and keep that right at the front of my equation so that I always remember what I'm solving for. Step 2 is you're going to want to insert your available quantities. So what is your order? What do you have available? Your third step is that you have to do those necessary conversions. Now you can skip step 3 if you don't need any conversions, but step 3 is always there so that you can ask yourself, do I need to do a conversion? Is it a time conversion? So I need to go from hours to minutes, or is it a metric conversion where I need to go from milligrams to micrograms or vice versa? And then step 4 is to calculate your answer. And then step 5 is the very most important step in dimensional analysis, and that is to ask yourself a series of questions. The first one is have you set up your equation properly? Now, it's important to remember that even though dimensional analysis looks like a fraction, it's not fractions, it's an equation. So remember, you're canceling out all of the different I guess, metric numbers that you don't need. So for example, if you have milligrams per 1 capsule, but what you're solving for is micrograms, you have to get rid of the milligrams because your final answer needs to be in micrograms. So, and this will make a little bit more sense on the next slide. We're going to work through a dimensional analysis problem. The second question is to ask yourself, have you done your conversion factor and did you set it up correctly? Finally, next, is your math correct? Fourth, have all of your units that you don't need been canceled? That is very, very important. If all of your units that you don't need haven't been canceled, then your equation is not set up correctly. And then fifth, and most important of all the questions you're going to ask yourself is, does your answer seem reasonable? So in my experience, I'll just give you some example or an example from teaching pediatrics is sometimes or in the past, I've had a student tell me that they were going to give 5,000 milliliters per hour to a neonate. Well, we almost never give 5,000 milliliters per hour to an adult. Now, maybe a burn patient, but not your average run-of-the-mill adult. So we would never give it to a neonate. So if you get that answer that you're convinced your math is right, but it doesn't make any sense, then you need to go back and reevaluate your question. Another great example is sometimes I'll have students tell me they're going to give 50 oral tablets. We would never give a client 50 oral tablets in 1 dose. So is your answer reasonable and does it make sense? Okay, let's look at this example. A client is prescribed acyclovir 0.8 grams, PO 3 times daily. The dispensing cabinet has acyclovir 200 milligram capsules available. How many capsules will the patient receive per dose? And then we have our rounding rules. So step 1 is to determine what our final answer is going to look like, and what we are solving for is capsules per dose. You don't have to put this at the front of your equation chain. I do because it reminds me all the time, this is what I'm solving for. Next, you're going to remember or put into your equation chain that 1 capsule equals 200 milligrams, and that's the dispensing cabinet. That's what I have actually in my hands to administer, 200 milligrams per 1 capsule. Then I know that I need to do a conversion, right? Because grams to milligrams, those are not the same. So here's my conversion, 1,000 milligrams equals 1 gram. And then finally, here's my order, 0.8 grams per dose. Now, my milligrams are going to cancel out. My grams are going to cancel out, and all I'm left with is capsules per dose, which if I go back and look at the beginning, that's exactly what I want. And so when you take 1000 times 0.8, you get 800. And when you take 200 times 1, you get 200. That tells you that your answer is 4 capsules per dose. I evaluate that answer. My math looks correct. I canceled out all of the units that I don't need. I included my conversion. The answer is reasonable and plausible. 4 capsules is the answer. Okay, so that's dimensional analysis. If that doesn't work for you, I'm not telling you to use it. I personally think it is a little bit of a complicated way to do math, but it does work in almost all situations where if you are doing formula math, you do have to memorize different formulas. So you have to decide what you think is easiest and what works best for you. Now, what I have on the screen are 5 very common calculations. Only 4 of them we're going to go through today, again, because this is a fundamentals conversation. So dose ordered divided by dose on hand will give you the number of tablets or capsules that you need to administer. Dose ordered divided by dose on hand times volume will give you the amount of milliliters that you need to either inject or give your client orally. Infusion time is usually pretty important. I'm sorry, milliliters per hour is the other one that we're going to talk about today. Total volume divided by time in hours. That's going to be in your prescription or your order. And then, of course, drops per minute is the same way. It's just we're administering drops per minute instead of milliliters per hour. Now, sometimes you're asked to solve for infusion time. So that means that you're given, let's say you want to give 2000 milliliters and you're going to run it at 125 milliliters per hour. And the question will want to know, how many hours is this bag of 1000 milliliters of fluid going to hang? So in how many hours are you going to need to go back as the nurse and take down that empty bag and hang another one? And that's just total volume divided by hourly rate. We don't tend to see that much on a fundamental standard exam, so I'm not going to go over that today, although the formula is very simple and it's very easy to figure out. So dimensional analysis versus formulas. Okay, so now we're going to start into the 4 most common types of calculations. I'm going to work all of them with formula math and dimensional analysis so that you can see how your way of working these problems. Okay, so our first calculation that we're going to talk about is going to be for administering those capsules or tablets. So we have that client who has heart failure, and the prescription is for digoxin 125 micrograms PO daily. And what we have available is digoxin PO 0.25 milligrams per tablet. And the question is, how many tablets should the nurse administer per dose? And then, of course, you have your rounding rules. So if you want to use dimensional analysis, awesome. If you want to use the formula is highlighted on the screen. It's going to be dose ordered divided by dose on hand. Now, step 1 is, do I need a conversion? And if we look at this problem, our order is in micrograms and what we have available is in milligrams. So you do need a conversion. Now, if you're going to do formula math, you need to go ahead and do that conversion now. If you're going to do dimensional analysis, you can set up your equation. Just don't forget to put your conversion factor into the equation. Now, I'm going to pause for about 1 minute if you want to work this problem on your own, and then I'll pop up the answers on the screen so that you can see if you're correct. Okay, so this one, of all the problems that we do, is probably one of the easiest. Coming up with or solving for tablets or capsules tends to be an easier type of problem. So again, that conversion. So if you want to do it first, it's 125 micrograms divided by 1,000, because we're going Micrograms is on the far right side of our acronym, and we need to go back to micrograms. So we're going to need to divide. So that'll be 0.125 milligrams. And then your answer, if you're using formulas, are 0.5 tablets. So 0.125 milligrams divided by 0.25 milligrams will give you 0.5. Dose ordered divided by dose on hand. Although your dose ordered has to already be converted to the correct unit of measure. That's formula. If you're doing dimensional analysis, you can set it up very similar to how I have this one set up. Again, what we're solving for is tablets per dose. You have 125 micrograms per dose, 1 milligram per 1,000 micrograms. That's your conversion. Your tablets come in 0.25 milligrams. And so we're canceling out our micrograms, we're canceling out our milligrams. What we're left with is tablet per dose, which is what we want. 125 divided by 250 is 0.5 tablets. Okay, you guys try this one. I'll give you a minute or so to work it out. Again, use formulas if that's what you're comfortable with. Use dimensional analysis if that is what you are more comfortable with. Okay, so the formula, if you're using formulas, dose ordered divided by dose on hand, dimensional analysis works as well. There is a conversion that is necessary, right? Our order is in grams, but what we have from the pharmacy is in milligrams. So if you're using formula, go ahead and do your conversion first. 2 grams is equivalent to 2,000 milligrams. So 1 gram equals 1,000 milligrams. So 2,000 milligrams divided by what you have on hand, 250 milligrams, will give you 8 tablets. If you're doing dimensional analysis, it will be set up very similar to this. So you are solving for tablets per dose. Your order is for 2 grams per dose. Here's your conversion. You have 1 tablet for 250 milligrams, and then 8 tablets. So 2,000 divided by 250 gives you the 8 tablets. So this one is going to involve volume. So now we have dose order divided by dose on hand, which is the same as what we've been doing, but we have to multiply by that volume because that's how it becomes a liquid. Otherwise, it stays milligrams or micrograms or grams or whatever the unit of measure was. So we have to multiply by that volume in the concentration so that we convert it to a liquid. Okay, so in this one, we have a client who has been instructed to take 25 milligrams of diphenhydramine oral syrup twice daily. And the medication comes in a bottle that contains, here's your concentration, 12.5 milligrams for every 5 milliliters. Now that slash sign does not mean divided by in a concentration, it means per. So for every 5 milliliters, you have 12.5 milligrams of diphenhydramine. And then the question is, how many milliliters will the nurse administer per dose? So if you want to use formula, dose ordered divided by dose on hand times volume. If you want to use dimensional analysis, this works as well. Don't forget to make sure you ask yourself, do I need a conversion or do I not need a conversion? And I'll give you a minute to think about this problem, and then we'll talk about the answer. Okay, so this one does not need a conversion. Your order is in milligrams, your medication is in milligrams, no conversion needed. If you're doing formula math, it's going to be 25 milligrams divided by 12.5 milligrams times 5 milliliters, and that is going to equal 10 milliliters is the dose that you will administer. Let's look at dimensional analysis. Again, we're solving for milliliters per dose. So our order is for 25 milligrams per dose. We have 5 milliliters in 12.5 milligrams. That's our concentration. Now that's different. That's a new step in our dimensional analysis equation. And then when we multiply these together, we get 125, and we're going to divide that by 12.5, and that gives us our 10 milliliters per dose. Remember, our milligrams are canceling out, and we're left with milliliters per dose, which is exactly what we want. Okay, let's take this one a step further. The order is the same, the concentration is the same, but now the question is asking you how many teaspoons will the nurse administer per dose. Now we do have a conversion. So I'll give you guys a second to figure this one out, and then we'll talk about it. Okay, so we've really already solved this problem, right? And we know the answer is 10 milliliters. So whether you did dimensional analysis or whether you did formula math, we've already solved for milliliters. So the only thing that we need to know now is how many milliliters are in 1 teaspoon. And there are 5 milliliters in 1 teaspoon. So all we have to do is take our 10 milliliters that we already figured out and divide it by 5, and then we get 2 teaspoons. But let's look at what that would look like if we were actually having to work this problem from scratch. So for formula math, it would look just like we did on step 1, and then we would just take that 10 milliliters, divide by 5, and that would give us 2 teaspoons. However, in dimensional analysis, you could work this as one long chain. So what you want is teaspoons per dose. What you have on, or your order is 25 milligrams per dose. Here's your concentration, 5 milliliters per 12.5 milligrams. Here's your conversion, 1 teaspoon to 5 milliliters. Our milliliters are canceling out, our milligrams are canceling out, and now what we're left with is teaspoons per dose. And so 125 divided by 62.5 is 2 teaspoons. Okay, let's try one more of these, and then we'll move on to our third set of problems. Okay, so again, our formula is dose ordered divided by dose on hand times volume. So if you're using formula math, however, dimensional analysis works just as well. So when we analyze our order versus what we have on hand, we do not need a conversion. So our formula will be 20 milliequivalents divided by 10 milliequivalents, dose order divided by dose on hand, times volume, which is 1 milliliter. That comes from the concentration, 10 milliequivalents in every 1 milliliter. The answer is 2 milliliters. If you want to work dimensional analysis, again, what you're solving for is milliliters per dose. 20 milliequivalents per dose is our order. What we have on hand is 1 milliliter for every 10 milliequivalents. When we do that multiplication, we get 20 divided by 10, which gives us our 2 milliliters. Okay, our next type of problem is going to be milliliters per hour. So very, very common, even super common in the real world, that this is the type of math that we're doing. So total volume divided by time in hours is going to be the formula, and dimensional analysis is going to look exactly the same. This is a pretty easy dimensional analysis equation. In fact, I almost don't even bother to set this one up in dimensional analysis because it's literally just total volume divided by time in minutes. So when we look at our total volume, it is 2,500 milliliters. That's our order. Now, this is important to remember. It doesn't matter what this is. You only need the total volume. This could be lactated ringers, normal saline, D5W. It could be D5W with 10 milliequivalents of potassium, so KCl. It doesn't matter what is in this volume. You're only looking for total volume, and you're dividing it by the number of hours that volume is supposed to run. So our order is 2,500 milliliters. In this case, it happens to be D5.045 normal saline. That doesn't matter though. And it's been ordered to run over 24 hours. So all we have to do is say 2,500 divided by 24. Very, very simple math. And then there is no conversion because it's ordered in hours. What we're solving for is hours. It's ordered in milliliters. What we're solving for is milliliters. 2,500 divided by 24, 104 milliliters per hour. Now remember, we said this before, milliliters per hour, always a whole number. Always, always, always a whole number. Okay, you guys try this one. Okay, so there are a couple of different things about this problem. So what we have ordered is albumosol 25% in a 50 milliliter vial. So 50 milliliters is your total volume. So remember, it doesn't have to be this huge amount of volume that we're giving. 50 milliliters in this problem is the volume. Remember, it does not matter what the volume is. That is irrelevant. Now, this time we're asked to give it over 30 minutes. And so in your mind, you're like, well, wait, you said total volume divided by time in hours. 30 minutes is not an hour. You're right. We have to do a conversion. So the easiest way to do this one is going to be to take your total volume, divide it by the time in minutes, and then convert it back to an hourly rate. So 50 milliliters divided by 30 minutes times 60 minutes, because there are 60 minutes in 1 hour, will give you the answer, which is 100 milliliters per hour. Now, if you were trying to work with the drop factor, that's junk. You don't need that. We're not doing drops per minute. We're doing milliliters per hour. If you want to set this up in dimensional analysis, it will definitely work. So again, what you're solving for is milliliters per hour. You have 50 milliliters over 30 minutes. That was your order. You have to do your time conversion. So your milliliters per hour is what you want to keep. Your minutes are going to cancel out. 3,000, so 50 times 60 divided by 30 is going to give you 100 milliliters per hour. Now, this will work whether you want to administer it over 15 minutes or 20 minutes or 45 minutes. So those intermittent IV infusions, maybe it's an antibiotic, maybe it's a proton pump inhibitor. There are lots of meds that we give patients IV, piggyback, multiple times a day that are very small volumes that get administered over less than an hour. And this formula or this setup for dimensional analysis will work to solve all of those types of problems. Okay, let's try this one. So remember, total volume divided by time in hours. We're solving for milliliters per hour. So in this case, we happen to have 150 milliliters of vancomycin 1 gram, but remember, that doesn't matter. Doesn't matter what's in it. It's just total volume. And we're going to divide that by time in hours, which is 1.5 hours. That gives us 100 milliliters. Now you can certainly set this up in dimensional analysis. I didn't put it out here for you because you've already seen what it looks like. It is such a simple equation. So 150 divided by 1.5. Okay, and then the last type of problem, very, very commonly seen on standardized exams for fundamental students, is going to be drops per minute. Now this one is going to be total volume, but this time we're going to divide it by time in minutes. And then we're going to multiply it times that drop factor. Now, you don't have to know or memorize drop factors of tubing. That will be given to you in the problem. So in this case, we have a provider that has ordered plasminate, 250 milliliters over 2 hours. Again, it does not matter what's in the volume. We're only looking for total volume. It's ordered in hours, and what we're solving for is minutes. So right then and there, you've got a conversion. In drops per minute, you're almost always going to have a conversion. Now, not always. You might have 250 milliliters ordered over 30 minutes. But if it's ordered in hours, don't forget to do your conversion. You're given a drop factor, and then you're told to calculate in drops per minute. So if you want to do formula math, I always do my conversions first. So I'm going to convert that 2 hours to minutes. So 2 times 60 minutes is 120 minutes. And then I can do 250 divided by 120 minutes times 12 drops per meal. That's the drop factor. Will give you 24.9, but this always has to be a whole number. So we have 25 drops per minute. If you want to set it up in dimensional analysis, you certainly can. You're solving for drops per minute. 250 milliliters is what's ordered in 2 hours. Here is your time conversion. Here is your drop factor. What we're solving for is drops per minute. So our hours need to cancel and our milliliters need to cancel. And what we're left with is drops per minute. 3,000 divided by 120 is 24.9. We're going to round it to 25 drops per minute. Okay, guys, I have one more for you to practice, and then we will be done today, and I will see if you have any questions. So remember, if you're using the formula, it's total volume divided by time in minutes times the drop factor. Now, what you notice right off the bat about this one is there is no conversion, right? Because this one was ordered 50 milliliters over 30 minutes. Again, remember, it does not matter what is in that 50 milliliters. That is junk. You don't have to do anything with it. Total volume divided by time in minutes times the drop factor. If you're doing formulas, it's 50 divided by 30 times 10, which will give you, I think it doesn't give you an even number, but of course we know we're going to round to a whole number. So it's going to be 17 drops per minute. And then if you want to do dimensional analysis, you're going to set it up exactly the same way that we set up on the last problem. You just don't need the conversion factor. Okay, guys, so that's all I have for you today on dosage calculation at a fundamentals level. Hopefully you found that helpful. If you have any questions, please don't hesitate to reach out to me via email, or you can leave a comment in the box below. Don't forget, I do have a quiz that goes along with this video. So it is a dosage calculation quiz. There are 12 questions of varying varieties, and an answer key is also provided. You can find the link to that quiz in my Etsy shop, and I will leave a link in the description box below. Have a wonderful day, and I will see you in the next video.